Hello, welcome once again to Moorgate Andrology. And in today's video, I want to talk about penile enlargement surgery techniques. What are the techniques to enlarge a penis, and can it be done? Well, the answer is yes. Penile enlargement surgery techniques are to lengthen and thicken the penis. Now, the technique to lengthen the penis involves the cutting of a ligament, and this ligament is called a suspensory ligament. It has just one function in the male body, and that is to keep the penis upright when it's erect. But when the ligament is divided, it can lengthen your penis because every man has hidden length, and this hidden length is revealed when this ligament is divided. What happens is the ligament is cut and it slides the penis forward and gives you this extra length. Now, the results of this technique are very predictable. We know that if this technique is done, the penis will lengthen between 1 to 2 inches more. 95% of cases, men will get an extra 1 to 2 inches. In 5% of cases, it can be a bit less than 1 or even a bit more than 2. But for most guys, the results are very predictable. Now, it's important to note that this technique will only lengthen the penis when it's flaccid, but it's highly sought after by men who are embarrassed, for example, when they're changing at the gym or at the football. They're concerned about how their penis looks when it's flaccid. This technique will give them those extra inch or extra inches that they are lacking. So this procedure is often called ligamentosis surgery. Ligamentosis surgery, the dividing of the suspensory ligament to increase a penis length. Now, the penis enlargement surgery technique to increase penis girth, to make a penis thicker, is a fat transfer. Now, fat transfer has been around for a long time in aesthetic surgery. Fat can be transferred to various parts of the body from one place to another. Typically, it's taken from the tummy or sometimes the inner thighs and can be transferred into the face if you want more to replace lost volume in your cheeks. It can be transferred to the buttocks. That's become really popular in recent years for buttock augmentation. And it can be put into the penis in small quantities to increase penis girth. Typically, the urologist will take about 200 mils of fat from your tummy, and he'll put this fat through a purification system that removes debris such as blood and oils from the fat that we don't want. That is then injected underneath the surface of the penis to thicken it. Now, the difference with a fat transfer technique is that the penis will be thicker both in the flaccid and erect states. That's why this is extremely popular with men. There are other techniques to thicken the penis, such as with temporary dermal fillers, the kind of fillers that people get when they want their wrinkles filled in their face. But these are temporary and very costly because you have to keep having it done after about 1 year. But with a fat transfer, after the initial absorption, the results are permanent. Around 30% of the fat that's injected, 30% of the fat that's injected in a fat transfer procedure will absorb. No matter how much the fat is purified beforehand, there is always some absorption. But the urologist will allow for that in the amount of fat that's transferred. The remaining fat will survive, providing your weight remains fairly stable and you don't lose a significant amount of weight. Now, the techniques for penis enlargement surgery have been developed over many years. And in the United Kingdom, the specialist doctor that performs penis enlargement surgery is a urologist. A urologist has the specialist knowledge and training in male genital procedures. So if you're considering a penis enlargement surgery operation, make sure that you see a fully qualified urologist for this procedure. That's all from me today. I hope that's given you some insight into penile enlargement surgery techniques to make the penis bigger. If you want to find out more, please visit our website at www.moorgateandrology.co.uk or get in touch with us and we'll arrange a consultation for you with one of our urologists. That's all from me today. I look forward to seeing you back here at Moorgate very soon. Until then, bye for now.